will be, or seem to be, at the top of the list. So the last shall become first, which is another good a good omen. And the third reason that I'm delighted to be chairman is that Steve is there to help out, because my technological skills are vastly inferior to Steve's. It's great that I shall be involved in this. I've got no recent experience of care homes, I have to admit. It's 12 years ago since my mother-in-law died and we had to stop visiting then, but I do have experience of lockdown from the perspective of somebody who has been diagnosed as clinically extremely vulnerable. I've got two incurable conditions. I've got multiple sclerosis and I've got a condition called MDS, which is a type of blood cancer. And as a result of both of those, I've been on the extremely vulnerable list. I've had to shield for the first part of lockdown, and I've just had a very long and detailed letter telling me what I can and more specifically what I can't do for this next period of time. So I share a lot of the frustration that many people connected with care homes do feel at this instant. I suspect, though, that like me, not many people thought they would end up in this situation. I was lucky enough to play sport at a very high level. I played rugby for England, I played professional cricket, and then I spent my working life jetting around the world working for the BBC. And to suddenly find myself in this situation is an extraordinarily difficult thing to take, as I suspect it is for so many people connected with the care homes and their carers and their relatives. But I also suspect that the philosophy that I've been able to develop alongside being disabled is shared by so many of people connected with the care homes. And that is simply a can-do philosophy. I don't believe that it's simple enough or easy enough to roll over and say, well, that's it. When people say you can't do something, my first question back is, why not? And then secondly, how can we do something that'll make this achieve the desired result? And then more specifically, what can I do that will help to achieve that process, to get the thing moving in that direction? And I suspect that that philosophy is the one thing that guides this HealthWatch seminar today. And it's very, very important that we preserve that positivity in looking at this event. And this event's all about looking back at the first lockdown, looking around at the second one, hearing from friends and relatives about their experiences the first time around, and hearing from healthcare partners as well, because they are very important. It's all a team effort. We have to all work together to achieve the best results. It's great that there's been such a media flurry around healthcare and homes, residential homes and healthcare connected with them in the last few days. And it therefore gives us this chance to shine a light on practices that work, to share lessons of things that we have learned along the way, to highlight the support that is available out there for the residents, for their relatives, for their support workers, and to help support not just the elderly, but also the isolated and the vulnerable. And there are thankfully so many things coming out that help along those ways. I'm sure you all saw that wonderful story about Paul Harvey of Lewis, the composer, music teacher who had dementia, and he composed something from 4 notes and it became a nationwide hit and was fantastic for highlighting the awareness of the Dementia Society and music for dementia. And that sort of interest, public interest in the plights of so many people is so important. And from a different point of view, I'm connected with a charity called the Sporting Memories Network charity, which does wonderful work with dementia, with helping people to talk through their memories, to prod their memories, to try and recapture so many things and ways of communicating. That has now brought out a program for care homes, specifically aimed at care homes and for this situation of lockdown. So everything seems to be coming together in a great way. And it seems that although there's no substitute for human contact, that is something we all miss. I miss desperately. I'm the grandfather to a 2-year-old and a 3-year-old, and my only contact with them in the last 9 months has been to look through a window and wave and do air hugs. And again, technology has come to my aid, because there's now something out there called Caribou, which enables me to Zoom my daughter, my granddaughter, and read stories with her, and she can turn the pages, she can color in things, we can really have a connection. So technology is coming to the aid, it's arriving with us, and this is a way of us all finding our way of engaging with it, engaging with each other, and promoting the best possible outcome for people in care homes and their relatives and their carers. Healthwatch locally are organising events like this. Healthwatch nationally, Sir Robert Francis, the chair of Healthwatch, has engaged with the government and demanded that Healthwatch be included in their considerations about the plight, if that's the right word, of people in residential homes, and that Healthwatch and the carers and the relatives need to be included in whatever provisions are being made. It's been a cruel period of time for those people connected with care homes, not being able to see their loved ones, not being able to touch, to hug, to hold. And it's very, very important that the carers and the relatives and the patients are brought into all considerations about where we go next and how we get out of where we are. So that is what this event's about. There's going to be breakout sessions. We're going to hear from some very, very knowledgeable and important speakers in a few moments. And we're also going to conduct a poll. And I want you to try and fill this in. You can see it on the various portals that we've got around here, but I'm just going to read out what the poll is asking us to answer, and we'll have the results towards the end. Should a family member be given key worker status to enable them to continue to safely visiting their loved one in a care home? And the options are yes, no, and I don't know what this means for us. So if you could all answer that, then we can have the results when we get nearer time to 6:30. Next thing though is for me to hand over to the real experts. And we're very, very grateful to have the presence of two people who are going to talk us through the next bit, setting the scene, responding to the local situation as a system, and all the challenges that surround visiting care home and their providers. So I want to pass you over now to Dr. Matthew Thomas, the GP, and Mike Derrick, who's the chair of the Hove and East Sussex Residential Care Home Association. So over to you, gentlemen.
Thank you very much indeed, Alistair. It's very kind of you. It's even kinder of you to call us experts. My wife would argue that the only thing I'm expert in is talking. So thank you very much for having me on. It's a great pleasure and a privilege to be involved in this webinar, and thank you for allowing me to do so. Sorry, my screen has gone half and half. So let me just, right. I've got a bit of an IT failure here. Well, I kick off from the first slide, which I think is what you're seeing, which says COVID-19, the impact on residents, families, care homes and community support staff, an emotional roller coaster. Let me tell you a little bit about myself. I'm a GP, or have been a GP for 30 years in East Sussex. We had a small rural practice, and I was involved in looking after a care home of around 60 that was partly nursing, partly care home, partly dementia care. So I have quite a reasonable experience of that interaction and what I used to see. and get involved with. I think that the statement I've highlighted here in yellow is quite striking, isn't it? And you know, to be fearful that your wife won't recognize you when all of this is over. It's a quote from the Alzheimer's Society, and when I first saw it, I thought, you know, it's heartbreaking. But it reminded me of a chap who visited his wife in our local nursing home daily. And they were both in their 60s, and she had a neurological disorder and was deteriorating. And I would watch him walk her around the garden. Every time I visited, that's what they were doing. And that's what this statement reminded me of. And it's really heart-wrenching to see that. Next slide, please. So I'm going to scene set here, really. I mean, I want to reassure you that this is all about you and your families, but I thought it would be helpful to give you a sort of an overview of what's been going on, as if you didn't know some of it. But this slide really takes you through some of the timeline here. And I think the really important thing is looking at the effects, both emotionally and in terms of tiredness, that we've all experienced, and from families to care homes to community staff. Those graphs, they track each other. I mean, they track each other with the professionals possibly a little less anxious and tired, but only just, because we've all been facing roughly the same thing. And across from February onwards, we've had or certainly from March the 25th onwards, we've had the Coronavirus Act, which the government put in place to help manage a pandemic. But of course, it sits against things that have been around for a long time: the Health and Social Care Act and the Human Rights Act. So there are other things at play here, and it's really important we, I guess, understand that. Because that's how we're going to help keep us all safe, and especially your family members. Next slide, please. I'm going to jump straight to the point here. And this is a summary of the guidance, the updated guidance we were given last week, which Mike is going to take you through in a little bit more depth. I'm going to, I mean, the diagram on the right is how I see it all, really, is we have a person. That person may be older, maybe may have learning difficulties, or dementia, or other diseases for which they are in a care home. And that person has the arms of their family around them. And around both of those, we have the care home and the care home staff, who are, I'm sure you'll agree, fantastic. And then around them, hopefully, the NHS, the Public Health England, Adult Social Care, CQC, the community care team, oops, sorry, my thing's gone again, and GPs and hospitals have their part to play. So the regulations as they are, as I'm sure you're reading, are, and I will read them out aloud, the new national guidance recognises the importance of maintaining opportunities for visiting to take place, which is critical for supporting the health and well-being of residents and their relationships with friends and family. It sets out measures that can be put in place to provide COVID-secure opportunities for families to meet, and expects care home providers, families, and local professionals to work together to find the right balance between the benefits of visiting and the risk of transmission of COVID-19 to care staff and vulnerable residents. The guidance identifies that the individual resident, their views, their needs, and well-being are an important focus of decisions around visiting, and all decisions around visiting should be taken in light of general legal obligations, such as those under the Equality Act 2010 and the Human Rights Act 1998 as applicable. Importantly, visiting as residents approach the end of their lives continues to be recognised, and visits in such exceptional circumstances, such as end of life, should continue in all circumstances. In the event of an outbreak in a care home, the home should close to visitors, except in exceptional circumstances such as end-of-life care. I think that's a really clear statement, and I hope it brings all of the groups on the right-hand side in this on this slide together in finding the right thing for the resident, the person, because we're talking about people who become patients and become residents, but they are people, and I think the important thing about this is working together. Next slide, please. So this slide again is a little busy, but again, I hope it shows you the balance of all the things we've had to deal with and cope and adapt to, and you'll see there that from the patient's perspective, losing your freedom, and that's effectively what it might amount to if you are isolated. Because you either are vulnerable, as Alistair has said, or because you have the infection, or there's an outbreak in your home, and that's quite something to take in, if indeed you can take it in. The difficulty in communication. We know that wearing a mask is so difficult to do, let alone communicate with someone who's wearing a mask. So that's a difficulty for our patient or person or resident. Wearing personal protective equipment. Those who are actively walking may well have to do that within a home as a resident. Otherwise, they really are limited. The mental health and their cognitive ability, their understanding of what is going on around them, can also suffer and had to be adapted to, as well as their physical health. And we've had to look at care planning, which is a way that we can allow their wishes and your wishes and the power of attorney's wishes to be taken into account whenever we do anything for your family members. And then finally, information technology. I mean, you can see where I'm going with all of this. It's pretty similar for all of us, which is why working together is so important here. And IT, as Alistair said, I think it's been a revelation. I mean, thank heavens, it's been a revelation. General practice, as you know, has converted to a model where we can we can actually help our patients on video. In a care home setting, as you probably are aware, care homes have been able to use iPads, mobile phones. They've been able to conduct, hopefully, visits between you and them via the mobile phone or the iPad. And also they've been able to connect with the care providers outside of the care home, like the community care staff and GPs. So I hope this nicely covers the things we've had to deal with and the risks we are trying to balance. And law is at the top of this because there are some legal obligations that the authorities and your care home have to cover. So thank you very much for listening to me. That's my last slide. I'll hand you over to Mike now.
Thanks, Matthew. Good evening, everyone. Thank you very much for the opportunity to speak at this evening's event, to help watch for organising it. So an awful lot of work gone in behind the scenes to make this work today. Care homes all recognise the vital importance of visiting, but we're also faced with a really difficult balancing act where we have to protect the most vulnerable people in our community, many of whom are extremely clinically vulnerable. A bit of a sort of about the broader context that we're working in as well. Obviously, the challenges we faced in the spring, where there were outbreaks in many care homes, which were very, very difficult to manage. The increasing prevalence of COVID in the local community over the last few weeks especially, and also the additional sort of winter pressures that we face at this time of year every year. So all care homes remain under a huge sustained pressure, coping with significant extra workload, lots of changes in guidance and ongoing staffing pressures as well as we go into the winter. So making safe visiting work is just one part of the many challenges that we're all facing. The National Care Forum, with more than 60 organisations, including both the local care associations in East and West Sussex, strongly support a joint call to action, which recognises the vital importance of visiting, but asks for some extra things to be put in place to make it happen and to make it safer. So this is testing to be made available for regular visitors to care homes, more support to create COVID-secure visiting areas in care homes, and for the government to support care homes with insurance indemnity as they have for the NHS. And we're working nationally to try and make this happen. In the meantime, we've got the new government guidance, which was published last Thursday as the lockdown started. So again, very short notice. This is intended to last for the duration of the lockdown. And it includes one or two new things that we've got to try and make work. So the use of separate visitor pods, or a dedicated space for visiting inside the care home. And this should, where possible, include the use of full height screens, perspex screens or glass screens. The use of a separate entrance for visitors and residents. No more than 2 constant visitors per resident. Continued use of PPE and social distancing. Booked visits only. And the continued use of window visits if necessary. And obviously visits inside the building generally are not allowed unless it's, as Matthew said, unless it's for end of life visits. The guidance does make clear that care homes should communicate regularly and clearly and involve families in decision making wherever possible. That is often a challenge. We've got an awful lot to do, but I think most care homes are doing a really good job of talking to families and explaining why they're where these challenges are and how we can work together to solve them. Obviously, what we're looking at now is what's going to happen at the end of the current lockdown period in well, hopefully 3 weeks' time, when we're probably going to revert to a local area-based approach. So we're working with our local public health team on the guidance for care homes to adapt during December. I hope that's helpful. Be around to answer questions later on as well. Thanks.
Thank you very much indeed, Mike and Matthew. That was great. We've just got Steve, our technical wizard, he's got a couple of things he needs to say to the gathering. So let's hand straight back to Steve.
Hi all, yes, so just wanted to apologise there for the presentation sharing until about halfway through that it wasn't full size, so I do apologise about that. And just also to reiterate a couple of things as we're going through the event that I should have mentioned at the beginning. Please do remember that we want everybody to be really open and honest about what they're saying. So please respect that what people are saying that is personal, private, doesn't leave this event. And also, please be aware that we're recording. So anything that you write in the chat, anything you say in this particular session, not in the breakout rooms, will be recorded. So do please bear that in mind. And Alistair, I wanted to see if you wanted the results of the poll. Would you like me to put that up?
Yeah, yes, that would be tremendous. Have you got them
Okay,
already?
so here we go. Let's put up the results of the poll. So hopefully everyone can see that.
Overwhelmingly in favour of a family member being given key worker status. Well, that's something to carry to the people that make the decisions, isn't it?
Thank you, Alistair.
Thank you very much indeed, Steve. We're moving very swiftly on, as they say in all the best chat shows. Next, we want to hear from Leslie Meach, who's got a relative's perspective on the first lockdown and the second.
Hello, thank you for letting me talk today. I have a fairly positive experience of after the lockdown, but just a quick history. I was very lucky that my mother was identified as having Alzheimer's very early, so we were able to get her onto Aricept, so it delayed the damage that was done to her. Unfortunately, my father was her main carer. He died in 2015, and Mummy felt unable to stay at home. With a lot of discussions, she had been in respite care in a local care home. She made the decision that she'd like to go there to have the appropriate help, as we couldn't cope with her at home. Although I had carers going in 4 times a day, I was going in twice a day. We still weren't getting it right. Anyway, that's just some background. Once she was moved into the care home, I very much became part of the family. It took a while for me to trust that they were giving her the best and that she was in the best place for her. She always said she was well cared for and everybody was very kind to her. And over time, she's been there, as I say, from 2015. I've become part of the Queensmead family. We worked out that in Mummy's case, it was better that she had very regular short visits rather than occasional long visits, as these weren't good for her. She also has episodes where they're almost like psychotic breaks, where she becomes very confused, she hallucinates, she regresses to a situation we lived through a civil war, and she sees and hears things from then and obviously becomes very distressed. And I'm one of the only people who can calm her down when in that situation. There is medication that is given, but we try and reduce that as much as possible. During the first lockdown, it went from me seeing my mother 5 to 6 times a week to not seeing her at all for 17 weeks. It was impossible to use things like iPads, FaceTime, or telephones because her condition was such, it just confused her. She could hear my voice and just became more distressed. The care home were amazing in trying to keep me up to date and letting me know what was happening. However, for me, it was very difficult. As a relative, you dealing with guilt about the fact that the person you love is in a care home. And no matter who you are, you think you should be looking after them. I know she was in the right place for her and they were excellent. I don't want to harp onto that too much, but I do think it is something that the powers that be need to take note of, because the deterioration in my mother was phenomenal. She never, ever didn't recognize me previously. We would have an occasion where she was a little confused, but within moments of hearing my voice, she knew it was me. She would take my hand, she would smile, even when she was very distressed. After the 17-week period of not seeing her, she didn't know who I was the first time I went in. Sorry, I thought I wouldn't get emotional. That has been very difficult to deal with. The care home, once again, has stepped up to the mark in the most amazing way. The manager got me to the side and explained that because my mother was bedbound, she doesn't go anywhere in the care home except for her own room, that as long as I wore full PPE, used all the sanitizing stuff, I could go into my mother's room, but obviously sit a little distant from her. We've also had the opportunity that I can go in, as I did before, for short times regularly, rather than trying to go in for one long period a week. And I've been going in 5 to 6 times a week again. I'll never get back what we lost from those 17 weeks. And in fact, when I saw my mum the other day and fed her, she had no idea who I was. I could have been anybody. But for me to see her and be with her, and for the fact that the manager, who I know is on the call today, has been so incredibly supportive, that the staff have gone out of their way, because I know it's difficult for them. They have to do more. I ring them, they have to meet me at the door. They have to make sure I've got the PPE on, that I've got my visor on, that's been cleaned with the relevant alcohol gel, because mummy can't cope with the mask. She can't see my face. I'm then escorted so I don't stop en route, and I go straight to her room. It's all time that they have to give me, and I'm incredibly grateful for that. I have to say, they've done it well, and there must be a way for other people to be able to see their loved ones in this incredibly difficult time. Please, can we all learn? And there's nothing more I can say except thank you to the people at the care home in Polegate who have ensured that I can start trying to reconnect with my mother and regain some of the ground we lost. Thank you.
Thank you very much, Leslie. What a moving testament. There's going to be some question and answers later on, but that was the residents' or the carers' point of view. Now we're going to move on to the director's point of view. Zoe Fry is the director at Valerie Manor in West Sussex, and I hope she's going to join us now.
Hi there. Can you hear me okay?
Yes, we can.
Lovely. Thank you. Thank you very much, Leslie. That was very, very moving, and I really appreciate you sharing your story with us. That must have been very hard to do, but I think it also makes me quite proud to be part of social care. And I also wanted to say thank you to my colleagues who are on the meeting as well. I want to reiterate what a lot of people have said. I think we're all saying the same thing. I think life has been a bit of a roller coaster. So I've owned Valerie Manor for 13 years now, and I was a registered manager for 12 of those years and lived on site for 10 years. And we're in such an unprecedented time for absolutely everybody. Wanted to start by saying it's been 8 months, and I won't focus on a lot of things that we've gone through, but as a care home, we started very early planning with our staff, our residents and our relatives as well. We overstaffed from a very, very early stage when we went into lockdown. When other companies were furloughing their staff, we actually over-recruited, and we're now in a position where we're so over-recruited, we're most really going to have to furlough our staff now because we haven't got enough work for them, because now we're in a position that we've got empty bedrooms. We were the first home in West Sussex to get an outstanding rating, which we're really proud of, and I think during this time the staff have shown how outstanding the care is that they really provide. Right at the very beginning, we actually developed a spreadsheet. My managers will laugh at me because of my spreadsheets, and I've got some residents in this meeting as well. And we reviewed all of our residents daily. And at the beginning, we were reviewing our residents to see whether not having visitors would affect their mental well-being, whether they might become malnourished, whether they might develop pressure sores, you know, if they were in their bedroom more. And we started looking at all the risks at a very early stage. And as Leslie said, we deal with individual family members to see how we can overcome individual problems. We also did that for, as time went on, what we were noticing was we needed to risk assess our relatives' mental health needs, because as time was going on, our relatives were becoming more and more distressed, absolutely understandably. As part of that as well, we reviewed all of our staff. So every day we were going through our staff, what they were going through at home, because our staff weren't seeing their parents, their grandparents, but they were giving up their time to come to the home and work. We came up with contingencies very early on. So very early on, we said, what if we get COVID? What if we, allow visitors? What happens? So every step of the way, we've tried to plan for the what ifs. And that included, have people got children? Would they come and work if we had COVID in the home? Would they come and work if we had an outbreak? If we had one positive, would they come and work? So all that was planned from early on. I think one of the key things that some of my colleagues have said as well is the involvement of staff and relatives and residents. As I said, I've got, I think, 5 residents on the call today. We're only a small home, we're a 23-bedded home, but we have regular relatives meeting via Zoom as well. And I think that there are 2 things for doing that. I think the first thing is I've had relatives who have been writing my policies and procedures with me. So every time a bit of guidance changes, I share that with relatives, I share it with staff, I share it with residents, and then we write the policies together. It's quite interesting, as we were having the poll, my manager and deputy who are there with the residents at the moment said the residents aren't sure whether they would want to welcome visitors into the home. So that's another interesting stance. I saw one of the comments on the chat saying it'd be interested to know who wouldn't support it, and I don't know which way they voted. But I think obviously we need to bear in mind also the anxieties of some of our residents about allowing visitors into the home, because it's been such a long time now as well. We developed wellbeing care plans. We actually developed a wellbeing coordinator, a member of staff who basically was in contact with all relatives. Each resident had a wellbeing care plan to say what were their issues, how could they stay in contact with somebody via IT, via garden visits, would they be distressed if they had a garden visit, would they need somebody with them communicating, because if somebody had dementia and they couldn't see somebody because they were wearing a mask, we had a member of staff there with a photo album explaining who they were. If somebody has hearing difficulties, because we were at a 2-metre distance, they had a member of staff communicating that with them. So that was all in the wellbeing care plans. More recently, our wellbeing care plans have turned into keeping in touch care plans, which now are revolving around our pod. I think I said earlier that we've planned in advance for most things. About 7 weeks ago now, we reached out to the community and we wanted to do a DIY SOS and see whether the local community wanted to come together and sponsor a visitors pod. That now opens this Thursday, and it's been absolutely amazing. So we've got safe visiting for the visitors pod starting this Thursday. There are problems. I saw in the chat earlier on that somebody said about having the screen from floor to ceiling. So again, our relatives have been involved in the design and what we can do. Relatives that have got expertise in audiology, for example, they've told us what equipment to buy. Some relatives have actually purchased equipment for us because there's so much to think of. But I think when you're involving relatives, staff and residents in all the decisions that you're making them in the best interests of everybody, I would say. Just an example of decisions that were made by residents at the beginning, because we were so petrified as staff, as I think I'm a nurse by background as well, and as nurses and somebody who works in social care, we want to wrap people up in cotton wool. We don't want people to come to any harm. And it's getting that balance right between people making the decisions themselves about what risk they want to take. And so the residents started making that decision. At first, we were keeping the residents, 2 meters apart from each other. But actually, they said, this is our home. We want to be in our own bubble. So every decision has been made with the residents, has been risk assessed, and all decisions have been supported by everyone. I won't say that we haven't had our problems, but we've learnt from those problems. I think, as well as policies and procedures, the relatives meeting, for example, has been a time for sharing. And I think somebody mentioned earlier on about coming into a care home. It's such a difficult time in somebody's life. In a normal situation, having somebody come into a care home who hasn't been able to view the room, is meeting staff who are wearing masks, don't know what staff look like, have never met them before, and then having to stay in their room for 2 weeks until they're 14 days clear. That is just unconceivable. It's just, I can't imagine it. So what our relatives came up with after some niggles about a resident who did come to us, we've come up with a buddy system. And a lot of our existing relatives have actually said, look, when you get a new resident in, put them in contact with the new relatives so that I can talk to them about what goes on at Valerie Manor, try and reassure them. And we're coming up with a new residents and relatives sort of like introduction pack, just of basic things that we would take for granted when people are wearing masks, and what we can learn from people who have, you know, had not bad experiences, but experiences that are just so difficult to take forward. Problems that we've come across, so insurance, again, my colleagues have mentioned that, litigation, the change in legislation, finances, that's a huge problem. We try and balance keeping people safe. We refused to take any admissions for 2 months, and sadly we had some residents pass away, but then we had to make the decision from a business point of view that actually the home can't continue functioning if we don't start taking admissions again. Obviously we're facing challenges now because it's unheard of for Valerie Manor to have empty beds, and we've got empty beds at the moment because of the concerns about people coming into care homes. We've paid for staff counselling throughout, so we really understand the need to look after our staff, because it's the staff caring for the residents and actually the relatives as well, which is so emotional. I haven't got any of the answers, but all I do know is that we want to work so closely with relatives, with residents, with staff to allow safe visiting. 2 weeks ago, we were on a conference call with Helen Watley, and we had a relative on the call, and we actually begged to become part of the pilot for the weekly testing. And she said that it was a long way off yet. But it's something that we would want and we would welcome, but unfortunately we don't have all the answers, and it's just such a sad, difficult time for everybody. So I find this really valuable as a social care worker as well. But thank you for listening, and thank you for giving me the opportunity to talk. Thank you
very much indeed, Zoe. That again really emphasising the importance of teamwork, of everybody looking at it from the broadest perspective possible. Now we're going to be able to hear from Helen Wildbohr, who's on the Relatives and Residents Association for the Quality of Life of Older People in Care. And let's switch straight to Helen. I hope you're there.
I am, yeah. Can you hear me?
Excellent, thank you.
Yeah, so thanks so much for inviting us to take part today. I think my colleague Trevor was down originally on your agenda. Clearly, I'm not Trevor, but I'm really pleased to be here and step into his shoes as best I can. My internet has been dropping out a bit. I don't know whether it's other people's or it's mine. So if I disappear, I apologise. I have not cut myself off, and I will try and rejoin if I do disappear from the screens. So I just wanted to share some insights really from our work supporting older people who are using care services. So for people who haven't heard of us, the Relatives and Residents Association is a charity. We work for better quality of life for older people needing care. We champion the rights of older people needing care in England by providing information, advice and support to empower older people and their friends and families, use their unique perspective to raise awareness and to influence policy and practice. We run a helpline providing one-to-one advice and support for older people and those who support them about their rights and entitlements. As I'm sure you can imagine, our helpline has been very busy throughout the pandemic, supporting families with a range of concerns. But today I'm going to focus on concerns around keeping families in contact and the impact that isolation is having on older people and their well-being. So we are now 9 months into visiting restrictions in care homes. Many care homes actually closed their doors before the first national lockdown was imposed. So have had some kind of restrictions in place since February, many of them. And we've heard some really good practice there from Zoe, but unfortunately our helpline hears about the not so good practice as well. And we hear that many families have had little or no meaningful contact with their friends and family since then. And I just wanted to share some examples and some stories really from what we're hearing through our website, through our helpline, which we published a lot of them on our website. And I'm going to start by talking about Brendan and Joan, who have been married for 63 years and are now only allowed window visits. Their last visit together was actually on their 63rd anniversary, just before lockdown was imposed. So Brendan describes how he now has to kneel down to speak to his wife, Joan, through the crack in the window. And Brendan himself is 83. And he says Joan would run to the window when she saw me, but couldn't understand why I couldn't go in. And after 5 minutes would turn away. That made me feel so sad and depressed. Joan would ask me, have you come to take me away from here? And Brendan would say, where do you want to go? And she would say, I want to go where you go, because she could see him driving away in his car. And Brendan describes how he used to weep driving away from those visits and feel so sorry for Joan and worry about her mind and what she's thinking about when he's not there. And we have heard of other examples of lifelong partnerships like that have been separated by the visiting restrictions. And for many relatives and friends as well, for those people who don't have any family, they visit regularly and they help with really practical things like helping people to eat or drink, or prompting them to remember to eat and drink, support with taking medications, helping with sort of dressing and other personal care needs. But family and friends also provide really practical emotional support. And this is not just about companionship and some company. That emotional support can help with things like relieving distress or confusion, supporting with things like communication, for example. And without that support, our helpline is hearing from people about the deterioration in people's mental health, but also in people's physical health. And for some people, the impact has been really significant. We hear through our helpline of people who've stopped eating, stopped drinking, losing weight, losing speech, and really just giving up on life. And one of our helpline callers told us about his wife starving herself to death. He said her death was due to the pandemic, but she didn't die from the virus itself. It wasn't coronavirus or the frailty of old age, which is what was written on her death certificate. It was death due to refusal to eat. She'd given up, no longer wanted to live. And for people with dementia who might struggle to understand why those visits suddenly stopped, people will think they've been abandoned, or they might think that their family members have passed away and that's why they're no longer visiting them. And for many residents, there's a double isolation happening here. So there's the isolation from external contacts in your external support networks, like your family and friends, if they're no longer able to be with you. But there's also isolation within the homes, as measures were put in place to try and restrict the spread of the virus through homes. As we've heard, people may not be able to socialise with other residents anymore, and those shared areas like dining rooms and lounges, for example, may have been closed and residents asked to stay in their rooms. And one resident has shared her story with us and said that the lack of contact with other residents was really hard. I missed those that I'd made friends with. I was very lonely. I felt so isolated. I had to fight mentally to survive. I noticed that my voice was weaker as I just wasn't talking so much. I made myself read poetry every day out loud. I felt the isolation was detrimental to my health. And now into a second national lockdown across England, and we're now in month 9 of these restrictions, as I said. I think we have to remember that the average length of stay in a care home is just over 2 years. And for many people, it's already too late, and too many people have already passed away without the support and the love and the comfort of their friends and family being around them in their last days and weeks. And too often we're hearing about those end-of-life visits that can still take place. You know, when everything else is shut down, we can still have end-of-life visits, but we're hearing that they are taking place very late in the day. So almost when people are very close to the end of their life, and they may not even know that their relative or their friend who've come to say goodbye is even there and is able to provide them with any comfort. So there's a lot of anxiety and a lot of a sense of loss, I think, about the time that's been lost and that can never be replaced, and the worry that this situation isn't going to change anytime soon. You know, we've had the good news of a vaccine over the last day or so, but really that's a more sort of medium, longer term plan than what's going to change in the immediate future. So there's a fear that things are not going to change in time for a lot of people. And one resident has said that she's so afraid that she's going to die in this place before lockdown is lifted, and I'll never get to meet my great grandson. And as has already been mentioned, relatives are also feeling the strain of this very challenging time. It's had a huge impact on their own mental health as well. For people who are now find themselves on the other side of the door, and as I said, are used to being there, sometimes daily, visiting with their loved ones, and providing support, providing voice, providing advocacy. And now as they watch from the window or the video screen as their relative in care sort of deteriorates before their eyes, and they feel helpless about it. And this is a quote from one of our stories on our website, which says, "I've been working really hard to keep mum living well with dementia, to stimulate her. That's now fallen off a cliff. I feel powerless and like I've let her down. Watching mum's decline, I can't wait to be allowed closer to her, to see what I can do to reawaken her brain cells. We can't be left as a result of COVID with a mum who can't speak, walk or talk, with her cognition gone. It will leave a huge hole in our lives that won't go away, and we will not get over losing this precious time with her." And also a word about staff who it's taking a huge toll on, and you know, doing what they can to help residents through this time of isolation, but knowing that they can never fill the void left by family and friends, and they can never replicate the love and the support that they get from those family and friends. And they've been working through incredibly difficult times, and also coping themselves with the isolation and the loss of residents and colleagues. So if I can just take a couple of minutes just to say what needs to change. So back in June, we called for a strategy from the government around safely opening up care homes to reconnect residents with their vital support networks. And we talked about that needing to happen urgently to prevent a mental health crisis in care. Here we are 5 months later, that didn't happen, and really we're in not much of a better place. We've seen inadequate guidance from the government on visiting that has led to unworkable policies in many care homes that have made visiting impossible for many families. We started a campaign called End Isolation in Care, calling for better guidance from the government on visiting, to provide support and the leadership that care providers need to help them to manage the virus safely, and to try and achieve a better balance between protecting people from the virus and protecting their rights, like their well-being. We joined calls. Now 130 organisations have grouped together to call on the government to grant relatives key worker status with access to regular testing. So far, we've only had a commitment from the government to pilot this scheme, which really was announced weeks ago now with no detail, no timeframes. And you know, as has been alluded to, that's still very much in the future. It's not happened yet. And for many, that's too little and too late. And last week's update of the government guidance, which now encourages visits behind screens, in pods or at windows, as we've heard, is impractical for many people who live in care settings, who find those kind of visits too distressing, and also just shows a fundamental misunderstanding about the kind of support that friends and family provide. And we now urgently need to provide that support to residents to ensure that their rights and their well-being can be protected.
Thank you very much indeed, Helen. That's sobering thoughts for all of us. It's important, I've stressed right from the beginning, we all have to work out how we can achieve what is possible, because letting it slide is not an option. There are obvious caveats and difficulties that have been put forward to us by the people who run the care homes and the people who try and enforce the policy, and the legal experts as well. So we've all got to, we're pushing at a door. I think we're all on the same side here, but we have to keep pushing, keep making it happen. I think now's the time where we're going to disappear for question and answer session. We've got the panelists, including Matthew Thomas, Michael, Derek, Helen, of course, Leslie Meach and Zoe Fide, people we've heard from already. We're having a question and answer session, which will be moderated by Lynn Fair. So if I can hand over to Lynn, that would be terrific.
Thanks very much indeed, Alistair, and thank you for inviting me to moderate. That sounds like a very strange word. It's not one that I'm used to, but there you go. Moderate this session. I've been looking at the comments that have been coming in, and we also had some questions that were provided earlier. And I think there's a whole richness of views and perspectives that have come in. But as Alistair's just said, it certainly sounds that everyone is pushing in the same direction. And what's become evident is the challenges and opportunities that there are showing in certain places, but that can't necessarily be fulfilled in others. And I picked up a few of the points that have come up on the chat line, first of all, and I just wanted to, the people that are on the panel don't know which questions I'm going to ask them, so they're probably all sitting there. It's a bit like on one of these quiz programs. I don't know what I'm going to be asking them, so I've got a big list here, so better watch yourself. You don't know what's going to come next. So Marilyn, old colleague of mine from Brighton, made the very good point about if key workers wear PPE and they touch a resident, so if a care worker can wear PPE and be able to touch a resident to provide personal care, if a relative is wearing PPE, then why can't they touch them in the same way? As Leslie described how when she visits her mum, she doesn't actually touch her mum, although she's wearing the same PPE. And I wondered if Matthew, our resident GP, have you got any thoughts on that, whether you think that that's any particular reason why a relative who's wearing all the appropriate PPE shouldn't be able to touch their loved one?
Oh gosh, yes, that's a really hard question to answer fully and comprehensively. I think logically, yes, it should happen. I think all the emotion that I've read in all of the questions in the chat show us that we have more thinking to do about how practically we put the latest guidance in place. I mean, I can't give you an answer that is anything other than yes, it seems completely reasonable.
Perhaps, thank you. Thanks, Matthew.
Sorry, Lynn, it's
yes,
Leslie.
Sorry, Leslie. Yes, do please.
I was just going to say, I have actually fed my mum and gone in so that there is a bit of touch then. I do make sure that I clean my hands well, that I actually change my gloves when I do the feeding. I understand perfectly that everybody is trying their best to protect not only me and my mother, but the staff and other people in the home. I know there have been times when mum has touched me and nobody's objected to it, but we're just doing everything we can to keep things as safe as possible.
Yeah, Yeah, thank you for that, Leslie, for clarifying that. I think that possibly one of the challenges for if family members are given key worker status to go into a home and wear PPE is this whole issue of learning how to put it on and take it off correctly. That might seem very simple, but if it's not done correctly, then it can cause all sorts of huge life-threatening problems. So were you shown how to put it on, or were you, because because of your professional past life, you know how to put it on?
As you are aware, and I will say to other people, I do have a clinical background. I was actually I was a midwifery tutor. I lectured law in relation to professional practices, and then I worked for CQC. So I do have a clinical background. However, even with that background, the manager spoke to me and just said, right, can we go through things? But it was just making sure, because she has an obligation to keep everybody safe. And so it was making sure I did do things correctly. And for example, like using the visor that I use, so that it's the face shield. When I arrive, I have a face mask on so that the staff take my temperature and everything. I then make sure that the face shield is wiped down with the correct antiseptic gel before I go into mum's room. And when I leave, that's wiped down again. And then I take off all the other PPE and get rid of it as I should do correctly. So yes, they went through to make sure I knew what I was doing.
Right. Okay. Thank you. Mike, perhaps I could come to you because a question that certainly will be coming up if it's achieved that there will be key worker status for a family member. I mean, there's one issue about a whole broader issue about how that one family member would be identified, and that would be an issue for the family as well as for the care home potentially. But the issue that's come out, that certainly from the chat, that would be is the challenges, the logistical and financial challenges for care homes to be able to support the training, the equipment, the time, as Leslie's described, of how she is supported to visit her mum. If you've got a care home that's got 30, 40, 50, 60, 70, 80 residents in it, what do you see as being the logistical and financial issues of being able to achieve for everybody what we've heard about from Leslie's experience?
It's a real challenge, because I mean, in our service, we run a learning disability service, and we have had an open visiting policy. So relatives just turn up whenever they wanted to visit people. Sometimes they phoned to make sure people were here first. So we've gone from that to having to run a booking system, to having to have staff meet people, escort them to the visitors pod, all of the cleaning in between visits, the supporting people to don and doff the PPE, and then physically supporting the residents to move around, obviously from where they normally live to the visiting area and back again. So all of that's hugely time consuming. And we have had some support from the government to fund some of this, but like everyone else, I'm pretty sure out there, it's nowhere near enough. So it is a real challenge. And just to go back to your earlier point, what's the challenge around adding lots of extra people, if you like, to our weekly testing program? Well, the first and biggest one is there is no capacity to add that many people to weekly testing at the moment. So they're struggling to keep up with weekly testing for care staff in care homes. There is no weekly testing on a routine basis for staff in the NHS at the moment, and that's partly because there's a capacity issue as well. So it's just about prioritising what limited resource there is. The tests are all free, funded by the government, so it's not a financial thing. I think it's just a capacity thing. And the other little bit of that is that if you imagine in a care service, we're trying to manage the risk that we've got. If you've got, say, 30 or 40 staff routinely coming in and out of the service, each of those members of staff has a network outside of their job where they're meeting people who live in their household or relatives in their bubble or whatever, kids at school. So there's lots of risks associated with each member of staff. And then you more or less double that, or maybe even treble that number of people coming in and out of the service with routine visitors. And you can see how even with the very best PPE procedures and everything else, you're just increasing the risk more and more and more. And that's the challenge. The other side of it is that visiting is absolutely vital. It's not about money. It's not about money. It's about the time resource of making all of this work.
But do you think it might be the time resource, but also the logistics and the financial implication? I mean, Zoe just talked in a very caring way, and I'll come to you, Zoe. Perhaps I'll ask you this question, is that you've just described the impact that COVID has had on your business, and at the end of the day, if you haven't got any income coming in, you can't support your residents, and you can't care for them. And you've just described that. We know that there's been extra money given to the NHS to keep going and provide for all the extra things that they need. You're a small care home. Small is very beautiful by how you've described it, but that does mean that you haven't got that extra finance of having hundreds of beds to have that ability to manage things. So what would the impact be for you if that you will have to find a way round if we get to the stage where there can be a key worker status for a family member on being able to do all the things that need to be done as Mike's just described? Would you need really extra financial support from the government to be able to put this into place safely?
Absolutely, and I think there's a real balance as well. And in being completely open, I said that right at the beginning we acted very fast. We actually spent £30,000 on PPE before we were even told to wear masks, etc. We've got 28 days worth of PPE should we have an outbreak, because we know that we will go through 304 masks over a 24-hour period to keep 23 residents safe. Our allocation from the government for PPE for our care home is 300 masks per week, and actually we can't even get that. We're only being given 200 masks at the moment. So the impact is absolutely huge, but what we've done is we've been very, very open with, again, our relatives and our residents. For 2 months we closed our doors to admissions, but we said actually we now need to open our doors to admissions, and the relatives came up with the policies and procedures with us to do that, even down to the finer detail of when somebody's coming out of hospital in an ambulance, is it better that we use our jalopy, as we call it, for our residents to go and get that resident from hospital? And so it's weighing up the risks against, the finances for the business. What we've done this week is talk to staff about it, and that's why we've come up with we need to furlough staff, because we're completely over recruited, which is a wonderful position to be in, but now we haven't got the hours. So we've got so many staff, we've got empty beds, and we haven't got people coming in, which is absolutely unheard of. I've contacted the council and the NHS saying, contract your beds to us, but unfortunately as a small home we're quite expensive. I obviously saw some of the questions that came in before, and some of the questions were, why are people being put in homes that may require improvement? And that's because it's economy of scale, and the government funding just isn't enough to provide safe, good quality care. So those are the risks.
Yeah, and that is one of the very big challenges of this balance that the local authorities have to put in place. And a question's just come in now about Gina's saying the local authorities are supposed to be having designated homes to take COVID. I think she means people that have COVID. And I don't know your thoughts on that. I don't know if I'm allowed to have a feeling about it as a moderator, but I'll chip it in anyway. Is that the thought that somebody goes from their home, say your care home, into hospital, and they have because they're COVID positive, and then they're not allowed to go home because they are COVID positive. They're not, they're put somewhere completely different, I think opens a whole other can of worms about someone becoming more of a commodity to be moved around. But I don't know what your thoughts are about that, Zoe.
I think that's very difficult. I think it's somebody's home, and you know, we've had people go into hospital, and touch wood, we haven't had anybody positive. But I think if somebody needs to come out of hospital, I think I'd most really get the support of my manager and deputy to say, could we bring them back to the home? Because I think, as people have said, if you're using the right PPE, if you're using the right infection control techniques, then actually you should bring somebody back to their own home and not to a different environment where they're not seeing people. That's my personal view. I would have thought the majority of my team would most really agree with me. Yeah.
Well, I would have thought that somebody who is being not, you know, deprived really the ability to have the love and support of their direct family, to be able to come home to a place where they can receive that professional love and support by the professional family that they have learned, that they have got to know, and that would also be reassuring for the person. But the issue is, of course, that if people are coming home from hospital being COVID positive, and if I could just move away from you now and come to Matthew, because someone's been asked that they've asked the question that they've heard, Matthew, that the council are starting to say that care homes have got to take people back that are COVID positive. We know that this was one of the battle lines that there was in the first wave of care homes being. I'm personally aware of some care homes that were being bullied by NHS hospitals, not in this area, but it's certainly in some of the in some other parts of England where they were being bullied and being told they'd be reported to CQC if they didn't take people back. And even though those care homes were saying people are entitled to have a second test, they're entitled to have negative tests before they come back because of the safety of everyone else living in that care home. So Matthew, my question to you that's come out the chat really is, are you aware if in this area, if we're moving back to the situation where care homes are being pressurised to take people back from hospital before they've become COVID negative?
No, I'm not aware of that. We certainly, when we have at the beginning of the pandemic, we looked at sites where COVID positive patients could be taken. It was agreed. They were set up to do so. There was testing that was agreed from the hospital end. So those care homes were specifically set up to do that job. So, for example, the Bexhill Care Centre was set up specifically to do that job. But I'm not aware that this has become a sporadic, watered down version applied to everyone.
Right. Thanks very much. I'm aware that we've got people in the audience who are from the local authority. Debbie Young, I know you're from West Sussex. We used to work together a long time ago. Debbie, I wondered if you could just give us a view about if you're aware, if there's anything, any movement within local authorities to look to be using some of the smaller care homes that aren't on the big, the big contracts, but also whether there are moves to try to make care homes take people back that are COVID positive still.
Okay, so first of all, we have a designated placement and sourcing team, which has been mobilised since the beginning of COVID, and they support with all the hospital discharge. So that'll be people, whether they fund their own care, whether they're supported by the local authority or health, because we don't actually assess at the point of discharging from hospital. So in terms of designated accommodation, it's a requirement from government guidance. So it's been set down, that's what local authorities should do. And I suggest that's probably because of what happened last time, Lynn. As you said, there were a number of discharges to care homes, of course, of people that are COVID positive. And of course, at that point, there wasn't the regular testing or the amount of testing that we now see. So in terms of designated accommodation, at this moment in time, we don't have any in West Sussex. That's not to say that we haven't approached providers. We haven't looked at using empty capacity or care homes that have recently closed. We just haven't managed to actually secure it at the moment. So we will be going out to the market this week. I can't offer a view whether I agree with that approach or not, because it wouldn't be appropriate. But what I would say is that obviously providers who respond to that need to think very carefully about how they can actually separate COVID positive patients, as they will be, from the remainder of the care home, and work in that area safely before responding.
Thank you, Debbie. That's very helpful. And I understand Samantha Williams, you're from East Sussex County Council. Are you able to give us a view if that's similar to what's happening in West Sussex, or if there's something else happening?
Yes, hi Lynn. I was just trying to type a response actually, which was getting very long and confused. So I've just deleted that. So can I just quickly separate out a couple of the issues? So in terms of the designated care settings that people have been talking about, that was an instruction to local authorities to identify designated care settings within their local authority boundary that would take COVID positive patients. In East Sussex, we offered that out to expressions of interest from local care homes, and a small number of care homes did put themselves forward as designated care settings. These are going through the CQC assurance process at the moment. We haven't had any further national guidance on how to operationalise that. So at the moment, nobody is going into any of those beds. As Dr. Thomas has just mentioned, we did in East Sussex with our health colleagues commission Bexhill Care Centre, which was a fairly recently closed nursing home actually. So we have commissioned that as a setting where COVID positive patients can be referred to. But we don't directly refer as a council COVID positive individuals into care homes. I do need to make that clear. I hope that answers all the different points. Thank you.
Yeah, I think so. Thanks, Samantha. And is there anybody from Brighton Council, local authority, that would be able to give us a view from Brighton at all? I don't know if there is.
Hi, Lynn.
Oh, a voice. Hello, Nicola. Sorry, thank you.
I'm a public health consultant in Brighton and Hove City Council, but similarly, we haven't yet fulfilled the instruction around designated settings. That's still in progress, and I understand we're not the only ones, but there are plans afoot, but it's not yet completed.
Right. So can I ask you then, with this guide, with the directive about designated settings, that the risks and benefits to the people being moved around will be part of the consideration as to whether it's in their best interest to move it. I understand the issue about getting people out of hospital, but if they're in hospital, whether it's actually going to be in their best interest to go to, I think, I know in one part of the country they're being called Nightingale care homes, to go to one of these places before they then go back to their own places, that the risks and the benefits could be, the risks could be somewhat greater if it caused them a great deal of distress. As we do know, people take a long time to settle.
Yeah, absolutely.
So and while I've got you on the screen, Nicola, I've got a captive audience now. I'm conscious of the time. I've got another couple of minutes, and someone has actually asked what if you would be able to give some information about what public health professionals are doing to support care homes during this time. I appreciate you're from Brighton, but I'm sure you can give a view about public health experts and how you're working to support care homes at the moment.
Sure. So I guess I can speak most specifically for Brighton and Hove, but I do work closely with my colleagues in East and West Sussex, as well as Surrey, actually, as well. So in terms of care home visiting, we have specific support that care homes can discuss how to carry out their risk assessments, both their individual risk assessments and their home risk assessments. And we continue to share all of the guidance. We have huddles, forums every 2 weeks with all of our care homes to try and address any issues and questions that care homes have. And we also have a designated person that care homes can talk to directly around issues around visiting, so that we can provide as much support as possible. We also work with our other colleagues, our health partners as well, in relation to outbreaks and how these are managed as well in relation to visiting.
Okay, and just a final question for you, Nicola. Sorry to catch you on the hop like this, but I'm seeing a number of questions coming in now, which is specifically around this issue of taking somebody out, and if the person lacks capacity to make that decision for themselves about whether they want to go out, whether a person who has a lasting power of attorney for health and welfare actually has the legal right to act on someone's best interest to take them out of a care home and take them out for a visit. Is that within the law, or is it just with guidance that people shouldn't be leaving care homes? What's the situation?
So the situation is it's all based on an individual risk assessment. And that will depend on whether or not there are cases in the home, whether or not there are cases related to that individual, the rate of cases in the community. So it's all based on individual risk assessment and in the best interests of that individual. So when we have cases, these are done on an individual risk assessment basis. If they are more complex situations, then we have an incident management team to discuss how to best make the decision for that individual.
Okay, so if I could ask you then, so if a relative, for example, decides I've used mum as a turn of phrase. If I decide I wanted to take my mum out, say tomorrow, she's in a care home, and mum isn't able to say, hasn't got the capacity, and I've got the lasting power of attorney, and I go to the care home and say, I want to take mum out for a drive, the care home may say yes, or they may say no, because at the moment we're in the middle of a national lockdown, which means I may or may not be allowed to do that legally anyway. But if the care home just said no, blanket no, then the issue around best interest decision making would come into play, would it? And that, as it would for anything. Have I made myself clear?
Yes. The guidance changed on Thursday evening, as you'll all know, and that guidance trumps the previous guidance, and therefore there is no blanket closure of visiting to all care homes as there was in the previous guidance before we had a framework that was under the Director of Public Health that we developed across Surrey and Sussex. Now the national guidance and the national policy has changed that. So the guidance in that means you are required to adhere to all of the legal frameworks in place and use a risk assessment, a dynamic risk assessment approach based on the situations.
Right, okay. So if we went back to on the 2nd of December, when Boris has promised us we're not going to be in lockdown anymore, and we go back to the tiered system, and just making an assumption now, and it is an assumption that we go back into the same level that we were in before, would I then, so on the 3rd of December, under those rules, been able to take my mum out if she wanted to go out and I think it was be in her best interest? It would be risk assessed at that time, but there would be no legal reason, would there, why I couldn't take her out? Or was there legal reason why I couldn't take her out?
At the moment, they've said that they're looking into the guidance when we come out of lockdown. So, do you know what? I think there are multiple legal reasons, because there's the Health Protection Act, there's the power of well-being, there's DOLS, the safeguarding, there's all sorts of legal precedents that overlap with each other. So they are looking at the guidance, I know, nationally, and that's what they updated as well on Thursday, that they'll look into this. And we have agreed that we would have a position across Sussex and Surrey together with my public health colleagues and my adult social care colleagues of how we support all of this.
Right, thank you. And of course, public health legislation actually trumps all the other legislation, doesn't it?
Yes, it does.
And that's what is important for people to remember, that it trumps the Mental Capacity Act. So even if someone's got a lasting power of attorney in this public emergency, the national emergency that we're in, the pandemic and the public health legislation sort of trumps everything.
It's very complicated, yes. And the coronavirus legislation is on top of other legislation that already exists for health protection as well. So, yes.
Yes, so it does. Thank you. It is very complicated, and we've got, there's so many layers. And I think when we hear stories like we heard this week or last week, where the lady, just sort of tried to kidnapped her mum and was arrested and all those things. There's so many competing things, and so many, a story like that would have so many things interwoven that it wouldn't be possible to dissect. But I think that you've been helpful to demonstrate that actually how things can, how the layers are, but the public health legislation at the moment is really trumping all of it. I'm just conscious that we've just got 3 minutes left.
Could I just chip in with something?
Certainly, please do, Helen. Thank you. I'm sorry I've neglected you a bit there.
That's okay, no worries. I've been enjoying listening. I think something that may be helpful for viewers, participants, we published on our website at the end of last week a little kind of explainer of the law around, if you're thinking of moving someone from a care home, what are the considerations around the legal implications, practical implications, financial? I'm happy to share the link, but hopefully it should be fairly easy to spot on the homepage of our website.
Thank you, Helen. That is certainly very interesting, and I know that I'm sure that I'll ask Liz to put the link up later as well, that the mental capacity law, the lawyers at 39 Essex Street have done some very good simple guidance to try to help understand the legal position of all the different bits of legislation around visiting. So it's not straightforward by any stretch of the imagination, and as frustrating as it is, it's I think that certainly what we've heard today so far is that it's as difficult and frustrating for care home providers as it is for family members, and everyone is sort of stuck between a rock and a hard place about many of these things. So I'm just dead on. I think according to my watch, it's 6:30. So that's the end of the open session, and trying to pick up some of the questions. I think with these things, you always end up with more questions than answers, because as one question's answered, it springs your mind into something else. And thank you very much indeed for those people that have been were roped into to answering some of those questions impromptu. So Alistair, I'll hand back to you, because I think we're now going to be going into the smaller groups, aren't we? But I'll hand back now to whoever it is that knows how we do that.
Thank you very much indeed, Lynn. That was a terrific seminar panel discussion, and thank you so much to the contributors talking about all those impossible dilemmas between the needs to have the mental and the emotional well-being of patients looked after, as well as the health of not just the residents, but also their relatives, and the legal aspects as well. It's a really difficult problem to solve, and it's so good to get these insights from people saying, this is what we've tried, these are the things that sometimes work, and it's going to help everybody to understand that, you know, there's no one size fits all solution, and we all need to work the best way of doing it. The buddy system that Zoe mentioned, you know, all of those sorts of things, making sure that everybody knows where and how to do things. It's so important that we all work together, but of course we have to bear in mind the legal aspect as well, and you know, the heartrending stories of the time away from relatives and loved ones and so on. It's very, very difficult, but you know, we're all pushing in the right direction, I think, and we can all work it out if we team together. It's my old sporting metaphor: teamwork wins. So with that in mind, we're going to move out now to the breakout question and answer sessions. You will have had the opportunity to choose which group you joined before joining this meeting. So with a bit of luck and Steve's incredible skill at sorting this out, we're going to let him parcel you up into the different discussion groups. Thank you so much.
Thank you, Alistair. Just to say, I'm just about to click the button that will send you all to your breakout rooms. So you will disappear from this, and it will say that you're moving. There might be a button that you need to press to go across and agree the invite. So when you're there, the breakout rooms aren't being recorded, and it's an opportunity for everyone to ask some of those difficult personal questions. We will be taking notes, and we will be providing feedback, but we will keep those notes anonymous. So just again, I mentioned to please ensure you allow everyone to speak. You've got facilitators in your breakout rooms that can support you. And I hope you have a useful discussion. If at any point you want to leave, then you can just press the leave and you will come back to this main area, and I will be here and 1 or 2 others will be here to support you. And if any of you don't disappear straight away, then we will sort that out as quickly as we can. So have an enjoyable breakout session. Ten seconds. So we've got some keen people that are back already. 5.
It's when you get a stopwatch
4,
clicking down in front of you,
3,
you can
2,
go.
1. Okay, everybody should now be back, Alistair.
Brilliant. Thank you so much indeed, everybody who contributed to these wonderful breakout sessions. I was lucky enough to be in on the emotion and wellbeing support session and learned a huge amount. And in some ways it's new, and in some ways it just confirms what we all know, really, that knowledge is power, that we need to know what is possible, what we can do, what the legal requirements are. And if somebody hides knowledge from us, then it leads to bad feelings and all the rest of it. So having the knowledge and then knowing what to do and how to work on it together seems to me the most important thing. And all the best examples that we heard about today have been down to teamwork, to people working together to solve common problems. And I think that is something that we can all take out of this, as well as all of those individual stories and individual viewpoints. We're going to wrap up now, and just to say that the next steps are that the evaluation forms will be sent out electronically. We hope to be able to have something to report back from this meeting within the next 7 days. So thank you ever so much, all of you, for turning up and for contributing so well. And I'm sure it's a thing that we're going to push forward and hope that we can all come to a successful outcome, which is health, well-being, security, and mental health for everybody involved in the care home situation. Thank you very much indeed.
Thank you, everybody.
Thank you to our